NewsAid is proud to be the media partner of the Hartford HealthCare Swim Across the Sound. Swimmers are crossing 15.5 miles from Port Jefferson to Bridgeport this Saturday, raising money for cancer. Across the Sound provides financial and program support to cancer patients and families across the state. Joining us to talk more about this wonderful event is medical oncologist Dr. Richard Zelkowitz with Hartford HealthCare Cancer Institute at St. Vincent's Medical Center. Doctor, thank you for your time.
My pleasure.
Well, we know that you are on the front line in the war against cancer. How does Swim Across the Sound really impact your cancer patients?
Well, I think swim, more than anything else, picks up where the insurance companies don't go. Supports patients in those costs that they can't get reimbursement for, and there are so many of those things, and we lose track of them. And it's such a big burden and stress to patients, and swim steps in there. The one that's closest to my heart as a breast cancer oncologist is cold cap. We have a very active cold cap program here. And while that may seem less important when you're fighting cancer, that's incredibly important to a patient when they're going through this. But they also help with costs of, home and groceries, and often with rent and all the things that reduce the burden on an already stressful situation for patients.
It's true. These things are something that patients and families really shouldn't have to worry about when they are going through treatment. And I have to say, I like the pink and I love the touches of pink in your office that we see there as well. Would you say that swim helps as well with the healing process?
I think anything that reduces stress is going to help with the healing process. Whether it's actually shrinking tumors and that kind of thing, I'm not sure. But we all know a good attitude and good mental health and less concern and less stress makes a very difficult situation much more tolerable.
Advanced cancer care, we understand, is now underway at the newly opened Fairfield Cancer Center. This is encouraging. What does this mean for patients?
I think it's a responsibility of everybody taking care of a patient, no matter what the illness is, to make sure you have the best available options for that patient. Being associated with Sloan Kettering, as far as I'm concerned, is the gold standard in this area. And so being able to access trials and their knowledge base and some of their technology is something that I have done for the past 20 plus years, and having that for our patients is incomparable.
Yeah, I admire you. I give you a lot of credit. The work that you do, it is certainly not easy. And I want to talk a little bit more. I just teased a little bit, as we say in news, teased a little bit about your pink gear. Now, I see the Yankees in the background. We don't have to talk about that here. But I understand that you wear pink every day.
The story is, and it may be a little bit hokey, but I think the pink has accomplished a huge amount. It has generated tons and tons of philanthropic money, which has changed the trajectory, especially for my breast cancer patients. When I look back at what I have now and what I had when I first started doing this in 1989, it's incomparable. And so much of that is supported by philanthropic money. And then there's the other aspect, and that is of making patients aware,
Right.
and making patients aware that there's pink out there, and I should get my mammogram. And I think on those on those 2 points, it's great.
Absolutely. Well said. Well, Dr. Zelkowitz, thank you for the work that you do, and thank you for your time this morning.
My pleasure. Thank you.